Assisted suicide is only legal in 9 states in the United States currently. Everyone should have the right to physician-assisted suicide. The financial impact, physical ailments, and emotional distress that severe deadly illnesses can have on an ill patient and one's family are all valid reasons to accept this medical treatment. Emotional distress is something frequently experienced by the patient and the patient's loved ones. Some family members of the patient with a severe illness may harbor negative feelings. Despite this, the patient may want to fix past issues and broken relationships before the patient passes away. This action may fully help the patient come to terms with their illness. There are certain treatments that can help all people involved deal with the grief and anxiety felt for the patient. Antidepressants can be an effective way to handle any severe depressive episodes, as well as medication for anxiety. Even without medication, people can still combat the emotional stress felt by regularly attending counseling.
This counseling also comes into play if the patient is considering physician-assisted suicide, to help the patient feel confident in whatever they decide to do and allow them to have their psychological state evaluated.
Another reason that physician-assisted suicide should be legal is due to the prolonging of someone's life with terminal illnesses often not benefiting that individual physically. Physicians are often pushed towards trying to prolong the life of patients regardless of the quality of life they are receiving through that treatment. Some of these treatments are aggressive, like resurrection. Resurrection often involves mouth-to-mouth, persistent chest presses, and at times even electric shock and breathing tubes to open up a person's airways. This can often lead to the patient having broken ribs, sore ribs, and even collapsed lungs. When the patient is suffering from a terminal illness, the effectiveness of resurrection is extremely low, according to Flores.
Trying to treat a currently untreatable illness also has a heavy financial effect on the patient and their family. The cost of maintaining a person dying of a terminal illness has been estimated to be about $2,000 to $10,000 a month, according to D. Workin, a cost that many families can't even afford. A study done in 2006 showed that 30% of people had problems paying medical bills, 16% used up all or most of their personal savings, 12% were unable to pay for basic necessities, and 5% declared bankruptcy. According to an article written by Emmanuel E.J. and 2 other people. Disclaimer.
Once everything is laid out, this should not be any of the first options decided upon by the patient's family members or the patient. Trying treatments that may have a chance of helping the patient recover should be priority, and if that doesn't work, then the patient should be able to talk about this option with their doctors. If the patient decides on this option, then it should be taken.